Survivors of sexual violence sometimes report to an emergency room seeking treatment.
Hi, what brings you in today?
I think I was assaulted last night and I need to see someone.
Okay, let's get you seen by a doctor.
It is important to get them back to an exam room as soon as possible to avoid adding unnecessary stress by having them sit in the lobby for an extended period of time. That a competent adult can choose to report to law enforcement. If the patient is a minor or a vulnerable adult, you must call DCF and law enforcement as a mandated reporter. The patient can receive a forensic exam within 120 hours of the assault, regardless of whether they are making a report to law enforcement. Any staff member can assist in making the call to law enforcement and the Victim Service Center.
This is some information about the Victim Service Center.
Or the patient can make the call on their own.
Thank you.
It is not necessary to keep the patient in the emergency room waiting for the detective after they have spoken with an officer or deputy. Once the patient is medically cleared, the provider can discharge the patient. Please note that medical emergencies take precedence over any evidence collection. If possible, while the patient is in the ER, avoid eating or drinking. Also, avoid having the patient urinate when possible. If removal of clothing is necessary for assessment or imaging, place clothing in separate paper bags. Both of the VSC Care Center sites are private, undisclosed locations. Here, the survivor will get acute crisis counseling and a forensic exam with evidence collection. Once discharged, the patient will then go to one of the VSC Care Center sites, either transported by law enforcement, driven by a family member or friend, or driving themselves. The address will be provided during the helpline call. The advocate and forensic nurse will meet the patient there within 60 minutes of the call. If the patient is not medically cleared and requires admission or is a Baker Act, the advocate and forensic nurse examiner can respond to the hospital to perform the forensic exam.
So today,
the advocate and forensic nurse will go over necessary documents, including consent forms and safety planning.
So we do crisis counseling. We also offer emotional support. And in 3 days' time after leaving here, I'll be calling you so that we can set an appointment date. You can either come in person or we can also do it virtually. So I'm just going to ask you just to sign your name right here for me, please. Write your name up here and give us a date. Okay, thank you so much.
Okay, and then we're also going to go over...
Then the nurse will obtain a medical history and assault history prior to the physical exam and evidence collection.
Here, so we'll swap there. Conclude photography as well. If there's any injuries, I'll take pictures of those. And I'll do, of course, a head-to-toe assessment with the exam. And if you're okay with that, you're going to sign right here, okay? Thank you very much.
The advocate remains with the survivor at all times, providing crisis intervention. The forensic nurse will collect evidence based upon the assault history provided by the survivor. The exam can include swabs, blood and urine for toxicology, photographs of injuries, speculum exam, and collection of clothing or any other items worn during the assault.
Next, you told me, I think, that he kissed you on your neck. Can you show me where that is? Okay. And then these swabs are going to be a little bit wet, okay? so it might feel a little bit cold. And this is just because our skin is dry, so we have to have it a little bit wet so we can swab here. Is this where it was? Okay. Okay, great. Okay. Okay, so here are the medications that
The
we
forensic
talked about
nurse
before. So
can
we
provide the survivor with medications necessary after a sexual assault, including but not limited to antibiotics for STIs. The survivor can take a shower at the care center site, and the advocate will provide new clothes and toiletries.
You're welcome. The documentation.
The survivor will be provided with follow-up resources for further STI treatment and testing, and the advocate will follow up with the survivor within 72 hours to continue crisis counseling and refer to a therapist with the Victim Service Center.
So just in case you need to speak to someone online before our session, you can always call our helpline. Okay, so I'm going to just package all your information here. All your paperworks will be in this folder. There you go.
The Victim Service Center team ensures that they have proper transportation and a safe place to go upon departure from the care center.